Christine Corby, OAM, is a board member of the Aboriginal Health and Medical Research Council of New South Wales, a board member of the New South Wales Rural Doctors Network and CEO of Walgett Aboriginal Medical Services. As a CEO, she is responsible for overall management, day-to-day management, as well as supporting and monitoring staff and building essential partnerships such as those with Rural Doctors Network. And just to add a little bit more, I've known Christine since the mid-1980s when we worked together, and I worked on it in Aboriginal health in Western New South Wales, and she still looks exactly the same, and I can't quite comprehend that, but and Kate Armstrong, welcome, is a Public Health Medical Officer at the Aboriginal Health and Medical Research Council of New South Wales. So welcome both of you. We look forward to your address.
It's all that Walgett air, see, no pollution, that's why the Botox works. Good morning, Yama. I wish to pay my respects to elders past and present and recognise we're meeting on Gadigal country, Eora Nation, and certainly Anne, another colleague in the 70s. It was lovely to have her here and do the welcome on our behalf. I'm Gummeroy, Walgett, New South Wales, second largest nation in New South Wales, so Anne and I will have a bit of a blurb about that later. But Gummeroy, Mum's country, and I've lived and worked in Walgett and had the pleasure of being there since early 70s. As a presentation with the partnership with the RDN and the AHMRC, my other life has been involved with the AHMRC for probably the 30 years that it's been in existence. So it's very exciting that we can actually present really good stories from our sector and the work the RDN has done with us. Okay, there we go. Christine, you want to talk about yourself?
Thank you. Thank you. I'll briefly introduce myself too. Thank you, and I'd like to thank Anne for the wonderful welcome that she gave us today. I have the privilege of working with her granddaughter, who she spoke about, Pauline, and she's just a fabulous young woman. My name's Kate Armstrong. I'm the Public Health Medical Officer at the AHMRC, and recently stepped into that role, although I was working there previously as one of the registrars, but it's a privilege to be here. Thank you.
Oh, we've got to work this.
There you go.
Right. Looking back, looking forward, reflection is everything, hindsight is everything, but in a positive light for us to present to you today, we want to show the good stories and certainly how you can improve things for the future. I believe as organisations, both the RDN and the HMRC can be very proud of their longevity in a business. We are NGOs, we are competitive, so to have the longevity and say we're both 30 years old, that's a fairly good milestone, and I wish to actually recognise the RDN board, John Kerner, who's the chair, Richard, of course, CEO, certainly Ian Cameron, who's been there for quite a long time as former CEO. With the chair of the HMRC, we have Scott Monaghan from up the North Coast, and also the acting CEO, Steve Blunden. So I thank you for them allowing me to do this today. As on the previous slide, the MOU, the Memorandum of Understanding between the AHMRC and RDN celebrates 10 years. And we just thought we'd reflect on some aspects of the MOU, share some of that with you today. Some of the guiding principles around self-determination, a holistic approach, mutual respect, trust and transparency, and an equal partnership certainly have featured very strongly in our relationship. The AHMRC sector in New South Wales has a very respectful and reciprocal relationship with RDN, and we really appreciate that partnership very much. RDN supports our member services to have access to GPs and a broad range of medical specialists, so cardiology, and I was just reading through the list today, there's a lot of different specialty services, and that's very much in line with our sector's commitment to holistic and comprehensive primary health care.
But RDN's not just about the doctors, and very much it's about support with nursing staff, allied health, and again, the list is there. It's exciting to see everyone that's here: podiatry, physiotherapy, audiology, speech pathology, OT, optometry, and I haven't listed everyone, but it's a really unique forum to have everyone here today like that. RDN also really supports our sector with recruitment, relocation grants, continuing professional development support and locums. So it really is very comprehensive. Some of the activities under the MOU, and we just thought we'd give a couple of brief examples and a bit of information on that, but also there's some more activities on the next slide. But after that, we'd also share some success stories. But RDN, the reach is amazing. All of the AHMRC services in New South Wales and also the ACT are supported by RDN, and the services that are delivered through the outreach program. More than 700 services in RDN's outreach program are specifically designed and developed with Aboriginal communities. And then the majority of these are delivered in Aboriginal community-controlled settings, which is really exciting. In the 5 years ending June 2018, close to 500,000 occasions of service have been accessed by Aboriginal patients who required specialist care. And Aboriginal-specific outreach services are provided in more than 130 rural, regional and urban towns across New South Wales and the ACT as a result. Some examples we're going to hear today. Werran, Dr. John Carrotta will be presenting on Friday, about the ENT surgery and outreach and complete hearing health pathway that's happening there. The team from Walgett will be presenting later on today about their nurse-led sleep apnea service, for example. Some of the other activities here, and particularly around workforce, just wanted to share a couple of mentions on that. The joint development of the rural resident Aboriginal the Medical Officer Cadetship Program is a really exciting program, and there are 11 Aboriginal medical students that have been enrolled and will complete 2 of their 3 first years of hospital training in an eligible hospital. So from a capacity development perspective, that's really exciting. There are also rural medical cadet events, and last year in Coogee there was a breakfast meeting for health professionals working in Aboriginal health and an opportunity for cadets and others to come together. We thought that pictures painted 1,000 words, and people really are at the heart of all of the success. So we're really just going to share some photos to start with, celebrating some of the successes, and we acknowledge that these aren't all of the stories, and we apologise in advance, but we had some great photos that we wanted to share. The Illawarra Aboriginal Medical Service down in Wollongong, the team there do an amazing job. They're funded for a GP, an Aboriginal health worker and an RN to deliver their cancer care outreach service. And those of you, and I've seen a few who are at the recent AHMRC Cancer Forum, will have delighted in learning from them and sharing some of the great work that they're doing. Another success, I guess, that we've had a lot of feedback from over the years have been the annual GP forums that AHMRC and RDN have been holding annually for GPs working in the AHMRC sector, and we get a lot of feedback that GPs value the chance to come together. And I'll hand over to Christine now to talk about the next phase.
The RDN Aboriginal Engagement Plan is quite new, and certainly for myself and other people around the state being members, I'll acknowledge them first and I'll talk about it. We have Tim Aitken from Werran, Dr Jason Sines, who I believe is an RDN cadet, Maxine Grenfield from TAFE Western New South Wales, Steve Blunden is the acting CEO of the AHMRC, and Kate. We have with the RDN Richard, being the CEO, Dr Rose Ellis, David Carlson, who's the manager, and Josie Newton, an Aboriginal lady, used to work with AHMRC, and she's crossed over to the RDN. So with the engagement plan, people, it was a time when reconciliation was around, and there was a conversation with the Reconciliation Action Plan, but we had a really good robust conversation, as Richard said earlier, about the definition and the purpose of a plan. Now, a plan must be holistic, as we all know, and not focus on, and can be sometimes compromised by using reconciliation. I mean, it's lovely to reconcile your differences, but I think we actually have a purpose of activity. So we have an Aboriginal engagement plan, and it's to deliver our culture wherever we live to the participants with the RDN, the services that are provided, the visitors. We recognise the importance of cultural orientation. You can always get a snippet here like we did today with Arnhem Land people, and certainly we recognise it's the Eora country here, but when you go home to your own country, well, things change. Customs change, behaviours change, and the expectation of the people who actually visit your community will change. So the Aboriginal engagement plan is certainly the driving force for us as Aboriginal communities. Another success story, of course, is the Glen, just up the Central Coast. Quite proud of what they've achieved. We had a local GP, Aboriginal chap from Canamble actually, who's been part of the success story, and the award, they were recognised at the RAC GP conference 2 years ago. Durry, Kempsey AMS, of course, they had a nurse practitioner-led chronic kidney disease service that focused on identifying patients living with or at risk of chronic kidney disease, and significantly increased the number of clients undergoing management plans. So that was really positive for us who know chronic disease and always see the connection with diabetes and kidneys. This is another photo of the Glen, and it's about a Central Coast Regional Outreach meeting with the Central Coast LHD staff and the primary healthcare personnel. It was an opportunity for people to come together and actually experience one of the very scarce rehab services that we have in New South Wales for our clients. So it's a good community conference, and it was an opportunity, as I say, to let people see what's around. The outreach service for optometry at the Orange AMS, Hamidi AHMRC, he provided not only the optometry screening on the day, but he also offered training and screening for Aboriginal health workers, and those guys are from Armstrong, which is in Varel. This is another primary care training service for eyes, Brian Holden Vision Institute, another essential partner that we all know of, and it's an optometry session for Aboriginal health workers and also Aboriginal health practitioners. Werran, up at Port, Macquarie, Dr John Carotta and Laurie Clay, Aboriginal health practitioner, providing ENT surgery clinic with the team up there. And Kate.
Just as the speakers before us, we acknowledge there are challenges. Speaking with Christine, it was really interesting to reflect on the definition of primary health care, and with the very high burden of chronic conditions and the need for, or the commitment of AHMRCs to deliver really holistic, comprehensive healthcare to communities. Services that were once considered secondary services really are now increasingly being embedded in primary health care services. A good example is diabetes, where people with diabetes, where they can access comprehensive specialist support from endocrinologists, diabetes educators, and podiatrists, renal physicians, the list goes on and on. So it's really interesting to reflect where primary health care services, but secondary care is increasingly important, and RDN really supports with that. RDN have created a service that complements the work of the AHMRC sector and doesn't duplicate, and we're very grateful for that. Of concern, demand is outstripping supply, and at some of the recent meetings with those comprehensive spreadsheets that Sharif gives us, it's clear that there is enormous need. The good news is we do have very clear pictures of what the needs are and the priorities are, but sometimes demand is outstripping supply. At the moment, there are more than 200 priority outreach services that aren't yet funded that have been identified. So this is a challenge. It's also an opportunity to respond in innovative ways and embrace partnerships and really find different ways to address the challenges that we face. Looking forward, Christine, I might get you to close for us with some of these reflections.
Whilst the RDN, as I mentioned earlier, has formally acknowledged these two significant events in our working lives, but we've also been involved, they are also involved in community events for which we really applaud. The AHMRC certainly believe in moving forward with the implementation of the Aboriginal Engagement Plan, which will validate both the good work of the sector and support services to our Aboriginal communities. If you would have seen the RDN website during Reconciliation Week, Steve Blunden and I were invited to make comments, and this is just a closing statement for us, what we know to be reconciliation, but we also know to be true engagement as Aboriginal organisations. Milestones in our life as Aboriginal people, 10 years with the apology, of course.
And I have the privilege of working with Steve as our acting CEO at AHMRC, and he tells me stories a lot about his upbringing and moving around. And I won't try and read it out because I always cry. I've tried to practice reading it out, but I cry. But it's a really powerful story.
And whilst it would appear we have questions for you and questions for us, I think the message we want to take away for each and every one of us today as service providers, as individuals, is how we improve our business and how we will move into the future. I think our planning is important. The regional reviews that we've undertaken, be it 12 months, planning we know is certainly cyclical, but perhaps from a discussion point here today, we'll look at a 12-month plan and a 3-year plan, perhaps just due to the funding cycle, but due to the growth. The real concern I see, and with total respect to what the RDN are offering, and the Commonwealth as well, and state health, but chronic disease, the burden of chronic disease, it's not a chronic disease anymore. Years ago we always talked about teeth being a body part, and now it's part of health. I think we need to look at the chronic diseases that we have so significantly identified, particularly in diabetes. We need to actually encapsulate that as primary health care, because I know we work it out there all the time, and with the changes with the NDIS, we need to have really strong preventative measures in place, otherwise we're just too unwell. But thank you.
Thank you.